And finally, to bring us home, we're going to hear from Maya Szalavitz, who's an American reporter and author of the New York Times bestseller, The Unbroken Brain, A Revolutionary New Way of Understanding Addiction, to which I recommend you all highly. Thank you, Maya.
Thank you so much for having me. I'm delighted and rather terrified. But I just want to start by saying we should not be calling this MAT. With any other treatment for any other disease or disorder, we don't say, I'm on Prozac-assisted treatment for my depression, or I'm on insulin-assisted treatment for my diabetes. We recognize that medication is appropriate treatment for a disease or a disorder. And so I think we've got to look starting right there from the stigma that lives right there in that name. I would propose counseling-assisted treatment for those because, according to the data, what actually saves lives and cuts the death rate in half is the medication, even if there's no counseling. Plus, I like the acronym CAT. Now I'm going to talk a little bit about some of the barriers that patients experience. Now, I am not currently a patient. I was a patient in the 80s, and that was a nightmare. Basically, it is the reason they call it orange handcuffs for being on methadone is because the experience is a carceral one. It is one of being controlled and being humiliated. I could have told them I was still using Coke, but no, I had to sit there and, try to eke out some pee in front of somebody because I was so dehydrated from shooting the Coke. But that would not have been acceptable. I would have not had the urine. So the humiliating and literally ghettoized nature of methadone clinics is deeply problematic. And we really need to, we can prescribe OxyContin to how many patients we want to do. So why can't we prescribe methadone or Suboxone to however many patients we want to do? If we are actually considering addiction to be a medical disease, we should not be treating these patients as somehow different and as somehow requiring of more surveillance because we are somehow evil, bad, scummy people that are going to lie to you. The stigma of addiction is often spread by people talking about how people with addiction, when do they lie? When their lips are moving. Now, if you actually look at self-report data from people with addiction compared to people without addiction, if they don't have a reason to lie, like any other human being, they won't lie. So it's really, again, we really need to stop having these barriers. And so I just talked to a bunch of people who are actively patients about what kind of barriers they're currently experiencing. So this is from a woman, she's on buprenorphine. My symptoms are dismissed as simply pill-seeking behavior, leading doctors to miss a giant tumor in my ovary that almost left me infertile. Our courts don't recognize Suboxone as being clean, their stigmatizing word. It's holding up the visitation of my children in this person. This is the mom of the patient. So she can't see her grandchildren because the mom can't see her children because Suboxone isn't clean. We get people, I have tons of stories of people thrown off of methadone or Suboxone for positive marijuana tests. Now, let me just say a study came out a couple of weeks ago showing that daily marijuana use was actually associated with better outcomes in medication-assisted treatment. Oops, I didn't mean to use that phrase. But yes, but also, do we throw people who have diabetes off of their insulin because they smoke pot? No, we do not. We recognize that a life-saving medication is a life-saving medication and people should be on it. I know that one of the federal agencies has warned that we shouldn't be throwing people off of opioids for benzodiazepines either. The main thing that we do in our system of providing methadone and buprenorphine is to create these barriers. So we don't require counseling for anything else. I have a lot of stories here about people, I want to do my job. I want to go to work, but I have to go to counseling 3 times a week, and it's in the middle of the day, and otherwise they're going to cut me off my medication. I have heard from a woman whose husband suffers from psychosis. He was on, I think, 120 milligrams of methadone. He went into the hospital. They took him down to 20 just because. And we also probably know that actually opioids are kind of good at reducing psychosis, so that was completely, there was no reason to do that to this person other than to make him suffer. We also have a problem with drug courts, that 2/3 of drug courts say that you're not allowed to use methadone or Suboxone, and that this does not count as treatment. So that they're basically, I reported a case a few years ago where a young man was doing well on methadone. Some old warrant came back to haunt him, and the judge insisted that he come off methadone, and he was dead of an overdose a few days later. He can't sue because you can't sue the justice system, but that kind of malpractice and that kind of practicing medicine by judges should not be happening. I've heard stories from women who, oh, you gave birth, no more methadone for you. I've heard stories, oh, you miscarried, we're going to cut your Subutex now. There is also just the ongoing intense stigma that people experience when they seek any kind of other medical care. As soon as they hear that you are a person with addiction, you get, oh, you're just here to fool me kind of thing, and that's the nicer version of it. There are also detoxes that have killed people because they couldn't pay for treatment anymore, and I haven't even gotten into the financial barriers. I know I'm towards the end of my time, but there's one more thing I want to say, which is one of the key things that we do in the medication treatment world is we require people to attend 12-step programs. Narcotics Anonymous, which is the primary 12-step program for people with opioid addiction, does not consider being on medication to be being clean or in recovery. So basically this means that we're sending people to a place that will stigmatize them. We're sending people to a place that will tell them to stop those evil meds, they're bad for you, you don't need them. If we really want to provide social support for people on medication, we should not be requiring them to attend programs that tell them that medication is bad. And I will be happy to take questions later. Thank you.